I remember the day my daughter Maria learned about bubbles. It was 1997, and she was 15 months old. I was sitting on our back steps, and she was standing in front of me. And when I pulled the wand out of the bottle and blew, bubbles surrounded her, and she giggled as she tried to catch them. And if one managed to make it to the ground without popping, she'd try to pick it up. I probably wouldn't remember this sweet memory, a blur in a million captured across a childhood. But I remember this moment with Maria blowing bubbles on the back steps because just 24 hours later, suddenly and unexpectedly, she died. That night, Maria developed a fever, but by morning it was gone and she was back to her usual happy, smiley self, playing with toys and dancing to Winnie the Pooh. Later that morning, she had a routine checkup scheduled with the pediatrician, so I thought it would be a good idea if she took a nap before we left. It all seemed so normal, so routine. At 10:38 a.m., I went to her crib. She was completely still and limp. I called 911 on speakerphone while I started CPR, and the police and the ambulance came so quickly. They rushed her to the local emergency department, and I know they tried everything. When all the doctors and nurses, with tears in their eyes, finally stopped trying, they had to admit what none of us wanted to believe, that it was just too late. Leaving her there at the hospital that day was the hardest thing I've ever had to do. I first asked to hold her, to sit in a chair, not trusting my legs to hold me up any longer. I started to twirl every brown lock of her hair, to smell her, to touch her beautiful soft skin, summoning every sense I could, trying to encase the memories and try to keep them safe for the rest of my life. Leaving her was just the hardest thing I've ever had to do. A close second was trying to figure out how to live after, without her. When a child dies suddenly and unexpectedly, the government launches a death investigation. The police determine if a crime has been committed. The medical examiner and coroner determine the cause of death and how someone dies using an autopsy and other tests. And if the child has siblings, then Child and Family Services investigate to ensure that the other children are safe and they're not at risk. And to be clear, these investigations are all very necessary. And I was grateful because of what I ultimately learned from them. But it was very difficult to think about an autopsy being performed on her. About 24 hours later, after the autopsy, the medical examiner called, and I leaned up against the wall trying to brace myself, knowing they would tell me everything I missed and all the ways I failed her. But I was shocked all over again. They told me they couldn't find anything wrong with her at all. They would do more tests. We had her funeral and buried her without understanding a thing. I remember in those early days of grief, talking to my own heart and asking, how are you possibly still beating? I remember how difficult sleep was. Or actually, it was the waking up that was so awful. That first brief moment of consciousness when I would not remember she died. And then I did. And it was like a ton of bricks crashing on my soul. I also remember tremendous love and support all around me. But what drove me was looking for answers. My quest was constant and my questions were painful. Could I have done something to prevent this? Was it genetic? Could it happen again? Did she suffer? Did she suffer while I was downstairs loading the dishwasher? I asked these questions to everyone I could, every doctor, every researcher, really anyone who would listen. But they were confused too, and they told me things like, Maria was unique. Maria was 1 in a million. Toddlers don't just die in their sleep without leaving a trace of an explanation behind. Believing them, I felt utterly alone. About a year later, in the early days of email communication and the World Wide Web, my questions and requests for help led to surprising new connections. Other moms and dads who shared eerily similar stories of their child's death. My Maria was absolutely unique, but her death certainly was not. We now know today that at least 400 families in the US every year are affected by the unexplained death of a child between the ages of 1 and 18 years. Most of these victims are toddlers. Sudden infant death is more common, and hundreds of millions of US research dollars have been dedicated to studying it, resulting in over 12,000 research publications. But unexplained child deaths after the first birthday, well, they just slip through the cracks. Barely anyone studies it, let alone reports it. If you look at this chart, you'd be forgiven for thinking that there's not that many deaths like Maria's. They're not even a leading cause of death, right? But that's because we don't include the data for unexplained deaths in the charts. But what if we do? What if we include them? Unexplained deaths are the 4th most common type of death in children ages 1 to 4. Maria and the other children like her died of something, and there's still children dying of something. But we can't prevent future victims if we don't pay attention and demand answers for the children that we've already lost. When Maria died, I was a physical therapist, and while it gave me vast knowledge in physical rehabilitation, I had no idea how to create a new field of research for something that the medical community didn't see. So I kept asking questions, accepting help, started a nonprofit to support efforts, and went back to school to get a Master's of Science degree from the Clinical and Translational Science Institute here at NYU Langone Health to hone my research skills. And due to the efforts of many, barriers that once blocked this research began to crack. Naming it with my first collaborator, Dr. Henry Kraus, was the first step. Sudden, unexplained death in childhood. It's not a diagnosis of something you find. It's an admission of a category of deaths that we have yet to understand. Successful state legislative efforts to recognize these children supported federal efforts, and this led to testifying in Congress, and then a bill signing in the Oval Office. In 2014, sudden unexplained deaths in childhood were recognized in US law. But still, the progress did not make the research easy. Trying to understand something where the first sign of a problem is death is inherently complex. And since most deaths like Maria's were sleep-related and unwitnessed, no one was in the room to help us identify clues as to what may have happened. So we started to learn more about the children from those who knew them best, their parents. We asked them many questions, and what first popped out of the data was surprising. A common type of seizures in young children. They're called febrile seizures because they're provoked by fevers or illness. But they're also considered largely harmless. Why would we be seeing them 10 times more frequently in children with sudden deaths? This puzzle led me to work with Dr. Orrin Devinsky, a neurologist and specialist in epilepsy and seizures. And together, we created the SUDC Registry and Research Collaborative, a place dedicated to understanding these children. Here, bereaved parents, researchers, and clinicians all work together to understand. It's difficult and emotional work, especially for the families. Some of them just enrolling a couple days after their child has died. But most of them tell me the exact same thing. They say, if you can learn anything from my child to possibly save someone else's, please do it. Now in our 10th year, I think about some of the accomplishments that we have made, and I see light. We've explained some deaths due to genetic changes that altered heart and brain functioning. We've shown that unexplained child deaths are likely undercounted due to variations in how deaths are investigated from one area to another. And some of our most recent data, it comes from crib camera video recordings. It shows that some deaths are indeed related to seizures. I know this research is really difficult to think about from every perspective. No one wants to think about death, let alone the death of a child. But by recognizing the problem, by breaking down barriers to research, and working together, we're answering questions, and understanding brings light and hope. Families affected no longer need to be alone. There's support from others who have walked a similar path and can smile true smiles again. Medical professionals and investigators now have clear guidance endorsed by their peers in caring for families and performing investigations. Our growing understanding of sudden child deaths also implore our policymakers to make changes, to recognize these children publicly, to ensure resources for quality investigations, and to fund research to explain and prevent these tragedies. How do we honor those we love? We tell their stories. My problem with Maria's story is that we don't understand her ending. And it seems utterly pointless to me to leave it as, we just don't know why she died. How does that help anyone else? I study children who have left us far too soon to understand their stories. I think they would want that. And I know we're capable of it. Thank you.